And while Anita is preparing, it also ties nicely to the keynote presentation by Richard, and also like the discussion by Stephen. I guess incorporating equity in economic analysis is actually it's not really a new area as discussed by Steve. I mean, people have been discussing this way earlier, but I guess it is group of methods that we are now starting to consider in our economic analysis.
So can you see that screen?
Yes.
Great. Sorry about that. I just got a bit lost. Okay, so thanks everyone for joining, and thanks for staying for the last talk of the day. So and thanks for the introduction, Paul. My presentation follows on nicely from Richard Cookson's presentation this morning, and it's an example of an Australian equity and cost effectiveness analysis. So I'm going to start with a bit of background, and then I'll talk about the study that looked at a sugary drinks tax in Australia. And throughout the presentation, I'll be looking for some audience participation using menti.com. So you can either use that on your phone, or I'll put the link to the presentation slides. Sorry, I was going to, because I thought I was starting a bit later, I didn't have this ready. Sorry about that. Just let me get the link, and I'll put this in the chat. So hopefully that works, and I'm going to just get you to either go to the link or go to your phone and answer that quick question. And the question is, have you read a paper that has quantified an equity in economic evaluation? So that's just a bit of a warm-up for you to use Menti. And interestingly, only a quarter have actually read a paper, so that's nice to know. So the study I'm going to present was part of my PhD, and this is part of the ACE Obesity Policy Project, and this was funded by the NHMRC. And we analysed 16 different interventions for the prevention of obesity using a standardised protocol. So things like a common reference year, perspective and time frame for the interventions. And one of my main objectives was to quantify equity. And this was particularly important because obesity impacts lower socioeconomic groups more than higher groups. So as part of my PhD, I did a review of studies quantifying equity in economic evaluations. And there were only 31 studies, and this was between 2010 and 2015. And I didn't put time limits on this. So this just shows you how new this area is. There was another review which went up to 2019, which was published in 2021, which had 54 studies, and 80% of these studies were published after 2015. So it really is a developing area. So when we talk about equity, this can refer to different things, such as equity of access, which is the equity of opportunity to use a service. And this is a supply side issue. And there's also equity of utilisation, which is the equity of using the service, which is a demand side issue. And there's also equity of health outcomes, which is an ideal, and we can demonstrate the health outcomes by modelling them. So just going into this in a little bit more detail, access is related to supply and what services are available. And we know that there aren't as many services in regional areas. Around 30% of the population in Australia live outside of major cities. But even if people have access to these services, this doesn't mean that they'll actually use them. So on the demand side, there'll be differences in utilisation of healthcare, and this can be due to costs as well as health literacy. And there's also cultural factors that influence the use of some interventions. And I'll give you an example. So a breast screen for cancer involves women taking their clothes off from the waist up and being x-rayed. And it was found that Indigenous women were less likely to participate in breast screening than non-Indigenous women. And this was because they didn't feel culturally safe. So in Victoria, these women are now provided with screening shawls to wear during their breast screen examinations. And I'm just going to go to Menti again. And this is another question. So, I don't know if I've just stuffed that up. So Indigenous women are less likely to participate in breast screening programs. And what type of equity are we trying to improve by introducing the shawl? And I'd just like you to enter either equity of utilisation, equity of access, equity of health outcomes. So there's 3 choices. And I'll just give you a couple of seconds to answer that. Don't worry if you're just guessing, I'm fine with that. You just put something in. Because these are concepts that people have mentioned today, but I know that they're probably new to a lot of you. Okay. If anyone needs the link, it's in the chat to Menti. You can also access this using it on your phone and entering the code. There's 18 people in the room and there's only 5 people who've put an answer in. Come on. Great. Okay, so the correct answer is actually equity of utilisation and equity of health outcomes. So this is a demand side equity issue because Indigenous women would have access to breast screening. So everyone has access over a certain age, but it's a matter of whether they actually want to use it. And by introducing the shawls, we're trying to increase the utilisation of breast screening. And as I mentioned before, equity of health outcomes, that's the ideal that we're trying to achieve. And so when we're trying to improve equity, we're also trying to improve equity of health outcomes. So it's a bit of a trick question, but the main answer is the equity of utilisation. So just a short recap of distributional cost effectiveness analysis in case you missed Richard's talk this morning. So when we look at traditional cost effectiveness analysis, it's based on utilitarianism, which is a principle of greatest good to the greatest number of people. And using cost effectiveness analysis, we look at total population impacts, which is this right-hand column here, and we want to maximise health gains. If we're interested in equity, we need to look at each group, each subgroup separately. So these are modelled separately. And this example is for colon cancer screening, and it compares a universal reminder, which would be like a letter endorsed by a GP, versus a targeted reminder, which would have a more personal letter signed by their personal GP and tailored information for this particular group. And as you can see, there's a higher impact for the targeted reminder in the lowest socioeconomic group. So usually DCEAs have 2 main stages. The first stage is the modelling of the subgroup distributions of health with each intervention. And the second part is comparing the distributions of health using health inequality measures. So we would then look at, once we've modelled these outcomes, we would then look at the the different health outcomes in these groups. So for the targeted group, there'd be a health inequality measure, and for the universal group, there'd be a health inequality measure calculated. So now I'm going to show you the example of a DCA using our analysis of the sugar sweetened beverage tax for Australia. So before we did this study, we knew from previous Australian research that the tax would be cost effective at a population level, and it would also improve population health and result in healthcare cost savings. And opponents of the tax were saying that disadvantaged groups would be hit hard by the tax. Mexico was the first country to introduce a tax, and disadvantaged groups were more likely to respond to price. So they did decrease their consumption. But we wanted to know what the health and economic impacts were going to be across different socioeconomic groups. So we assessed a 20% tax across all the 5 socioeconomic groups in Australia. And we wanted to look at the distribution of health gains across these groups. And we also investigated the financial impact in terms of out-of-pocket costs. And when we talk about a tax, it's a 20% tax, and it included drinks such as soft drinks and fruit drinks with added sugar. So this graph shows average daily consumption of sugary drinks for males before the tax, and it's split by CEFA quintile. And as you can see, there's a social gradient of sugary drink intake, with the most disadvantaged group in Q1 here consuming the most per day. And we use price elasticities to measure the change in demand for sugary drinks. So a price elasticity indicates a percentage change in consumption due to a change in price, and a negative number indicates consumption will decrease. And these were derived from Australian household supermarket data, with the population divided into 3 income groups. And so, for example, a 20% tax would result in a 15% decrease in demand in the lowest income group, compared to 13% in the highest income group. And we expect high income households to respond less to price because they can afford to pay more. And this data wasn't available by quintile, so we had to use linear interpolation to calculate the price elasticities for the 5 groups. So, and this is one of the challenges of subgroup modelling. So we actually assumed the lowest income was quintile 1, the middle income was quintile 3, and this was quintile 5. So this slide shows the event pathway used for modelling the health effects for each socioeconomic group. So due to a price increase, consumption of sugary drinks changes, and the consumption of substitute drinks increases, and substitutes would be things such as fruit juice and coffee. And this change in consumption leads to a change in energy intake and a kilojoule intake, and this leads to a change in weight and BMI. And this was then modelled to determine the change in health outcomes, which are measured in health adjusted life years, or HALYs. And HALYs are a composite measure of QALYs and DALYs. And we use this composite measure because QALYs were used to measure changes in childhood obesity health impacts, because they're not affected by the chronic diseases that show up later in life. And DALYs were used for adults. So we use socioeconomic index for areas, or CEFA quintiles, to separate the population. And this is one of the ABS ranks of socioeconomic position. So each quintile was modelled separately, and we used CEFA specific disease incidence, obesity prevalence, and mortality rates. And we actually have great, really good disease data in Australia, by CIFA, but to model by different ages was a challenge. So we don't have that sort of fine level data, but to get around this, we did adjustments of the general population data using CIFA rate ratios. And I'll probably have time to talk about that later, but I'll just leave that for now. As a result of a change in BMI, we modelled the variations in the 9 diseases caused by obesity using a Markov cohort model. And the model then estimates the resulting differences in life expectancy and health adjusted life years. So moving to the results, this graph shows the number of predicted HALIs saved in each quintile. And you can see the largest health gains in these 2 lowest quintiles, which are the darker blue quadrants here on the right. The health gains are actually twice as much as in quintile 1 and 2 as they are in quintile 5 here, which is this light blue piece. So these 2 quintiles would be more price sensitive. And so this means that they're more likely to stop buying soft drinks when prices increased. And they're also higher consumers of sugary drinks, so there's greater scope for reduction. We also found that there was less than $5 a year difference in tax paid between these 2 quintiles, the lowest and the highest. And there was also greater out-of-pocket healthcare cost savings in quintile 1, and this was as a percentage of household expenditure. So this is how equity was incorporated in a quantitative and transparent way by calculating the health gains in each quintile, the out-of-pocket costs of the tax, and also the out-of-pocket costs of healthcare. So stage 2 of the analysis was the health equity analysis, and we modelled 4 other tax scenarios. And you can see them here: a 30% tax, a 50% pass-through of a 20% tax, which just means that the retailers might not pass on all of the tax. So this would amount to a 10% tax. A tax including flavoured milk, and also a 50 cent per litre tax. So this stage 2 involves the calculation of health inequality indexes. And we calculated concentration indexes for each tax scenario. And these concentration indexes quantify the degree to which the HALIs gains are concentrated in the disadvantaged groups. And then we're then able to compare the different taxes to see which is the most equitable. So I'll just go back to this slide, which you may have already seen this morning. And this is the health equity plane. On the horizontal line here, we have the equity impact, which is usually measured by health inequality indexes. And I mentioned concentration index or Gini indexes could also be used. And the vertical line here is the overall health benefit for the population. So the outcomes for the sugary drinks tax were all in this win-win quadrant, which means that they improved equity and they also improved overall health of the population. Sorry. And so this next slide that I'm going to show you is a diagram of this win-win quadrant in a focused way, a zoomed in way. So I mentioned earlier that we looked at 5 different tax scenarios, and you can see each tax scenario is plotted on the health equity plane. And equity impact is measured by concentration index, which is a measure of health inequality, and this is calculated from the HALI gains in each socioeconomic group. And here I've multiplied the concentration index by 100 and made them positive, just so it's easier for you to understand here. So they're whole numbers. And a larger concentration index means that the policy is more equitable. So going along towards the right means that these are more equitable on this far right side. The total health gains are on this vertical axis, with 30% having the highest health gains. So now there's a little bit more of audience participation, and you can use the link in the chat again. And I'm just going to go to this next question. And I want you to choose which tax scenario you would choose for Australia based on the equity and the total health gains overall. So just to remind you that all of these scenarios did improve equity and they were cost effective. They all improved the health outcomes. And, you know, going towards more the right, this is the most equitable intervention. It's 10% tax. And heading up towards here is the maximum health gains. So I'll just give you a little bit of time to choose an option. There's no right or wrong answers, so please just put in an answer. And that's great. I've got some responses here. And there was actually, so there was a student presentation today about aversion to inequality measures, which ties in nicely here. I'll just let a few more people make their vote.
Oh, that was a day.
Matt, I'm just presenting right now. Sorry. Okay, so I think that's given everyone enough time. And we have most people voting for this 50 cent per litre tax. I'll just go back to this slide. And also, there was a 50% per litre tax and also the 30% tax. So these two options here. And yeah, as I was talking about the version of inequality. So the more to the right option that you choose shows a greater aversion to inequality. And so if you're not as averse to inequality, you would have chosen this scenario here with maximum health benefits with a lesser equity impact. But yeah, so two great choices, I think, that everyone's chosen. It's interesting that there were only two options that everyone chose as well. So we'll just talk a little bit about research impact. And, you know, I get drummed in at in our department now about research impact. It's not just about how many citations a paper gets. You also need to demonstrate research impact in other ways. And this paper attracted quite a bit of media attention when it came out. There was a media release done, and I was also interviewed by ABC Radio. I did a live radio interview at the time, which was pretty daunting, but was a great experience. And this analysis has actually been used for a few different policy documents for the World Bank and the Australian Medical Association They've used this for their position on a tax on sugary drinks. The results have been used to substantiate policy recommendations in a pre-budget submission to Treasury by the Obesity Policy Coalition and the Sustainable Health Review for the Western Australian Government. And this study is included in the ACE Obesity Policy Report, which I showed you earlier in one of my earlier slides. And this is utilised by government officials and frequently used to substantiate policy advice or recommendations. And this paper has also been used for teaching purposes in postgrad courses for health economics and public health at various universities in Australia. We're yet to see a tax on sugary drinks here in Australia, but with a change of government on the weekend, I'm remaining hopeful. So just some concluding remarks. So one of the main challenges of analysing an intervention using distributional equity impacts is the data requirements. So there'll be challenges in finding and gathering the inputs for different groups, and there may be some data manipulation required to fill in gaps. On the positive side, this quantitative, transparent evidence can be used by decision makers to assess the impact of policies across socioeconomic groups. And by incorporating equity in economic evaluation, we're providing policymakers with more constructive information regarding the health equity consequences of potential policies alongside overall cost effectiveness analysis. And I just wanted to mention that if you are interested in equity, I suggest that you look at the special interest groups that are offered in IHEA and also ISPOR, and maybe there may be one coming to AHES soon. Stay tuned. So that's just the references there. And I'm also happy for you to contact me with any questions that you have. Maybe you're thinking about doing an evaluation and you need just a little bit of help with something. I'm happy for you to contact me. And I'm also happy if we have time just to, or if people are interested in, I can show you that little bit of calculation that might need to be done when you don't have all the data that you need to calculate maybe an incidence of disease by age. But I'll leave that to you. Okay, now I'll stop sharing. And thank you for your time.
Thank you, Anita. That was a fantastic presentation. I really enjoyed it, and I really like that you walk through every of the steps of the study. It's a fantastic study, and like no wonder that it attracted so much attention, right? Because there has been so much debate about the like sugar taxes and everything, that having some evidence like this, I think it's a like big step forward. Are there any questions from the audience? Anyone? Paul?
Yeah, I guess to start, also Mariano is the one who presented the inequity version, is also here. But my
Great.
really is for the distribution CA. This is actually a topic that really interested me even more than the extended CA. But I'm just wondering, what are the scenarios or situation wherein a distributional CA would be useful, and what are the scenarios wherein a conventional CA would suffice? Because I would think that there may be cases wherein we don't really need to examine the equity.
Yeah, I think when the health condition has a greater impact in lower socioeconomic groups, I think that's when it becomes important. So with obesity, we do see that socioeconomic gradient in the, with the lower socioeconomic groups being affected more by obesity and having a greater prevalence of obesity than higher groups. So I think it is more important in those cases. And I think, you know, in this example where you're trying to compare different interventions for their impact on different groups, I think that's when it becomes useful also. Yeah, I think I've answered that question.
Thank you, Anita. Marie, do you want to ask your question?
Yes. Hi, Anita. Thank you for your presentation.
Hi, Marie.
I actually have a very general question. So I have been working on equity for almost a year now, and well, you have been working for a lot longer than me. And there's something that always came to my mind, and I always wondered, why isn't equity incorporated in economic evaluations in Australia, even though we have methods to incorporate it? Why isn't it used?
I think it's because of the challenges in actually doing the analysis. So it takes a lot more work, it takes a lot more data. And as I mentioned briefly, that a lot of the outcomes need to be measured by the group that you want to analyze. So, you know, for example, you need the outcomes by CIFA quintile, if that's what you're looking at, which aren't always measured unless you're, you know, at the start of the intervention where you can say, I want these effect sizes measured, you know, in these different groups. And usually, well, there may not be enough people to split, you know, the population in that way, the study population. Yeah, I think it basically comes down to the data requirements.
Okay.
But also what Paul said, you know, you don't always need to do this type of analysis. It is nice to do, but it may not always be necessary.
Yeah, okay, thank you.
Thank you, Anita. Francisco, do you want to ask your question?
Yeah, sure. Thank you. Hi, Anita.
Hi.
I'm actually from Mexico, and I have kind of a comment and a question. Because you know, you mentioned that Mexico was one of the countries that imposed tax on sugary beverages, and I do remember that when that was imposed, a lot of people, you know, obviously did not agree, and a lot of families would choose to buy sugary drinks over milk or other products. So I'm wondering, in this type of analysis, is there a way of, you know, incorporating like this on like changes in behavior for consumers, in where like maybe they don't stop consuming that product, but they change the consumption from others?
Yeah, so the analysis that we did actually did look at substitutes. So there were price elasticities that were reported for substitute drinks as well. So people may have switched from, for example, what you said, if they may have switched to not flavored milk, plain milk, which doesn't have sugar in it, hopefully, or coffee or tea or water. Yeah, those were some of the substitutes that were reported.
Yeah, thank you.
Yeah, so, you know, it's not just, you know, I mean, you would assume that people, if they're thirsty, they are going to drink something else. They're not just going to not drink anything. So, yeah, we did take that into account.
Thank you, Anita. Viola, do you want to ask your question?
Yes, thank you. Hi, Anita. I'm a PhD student with an interest in this area, but not much experience. And I've just started looking at the CIFA data, and I was looking at the 2011, and they reported it in deciles. And I was just wondering, and I know that you used quintiles, just, you know, I suppose why use quintiles, and, you know, whether there's a preferred way of reporting.
Yep. So Is this, are you talking about the census data or?
Yeah, the census data. So I'm looking at basically patient data, patient admission, patient presentation data, and I'm interested in looking at like frequent presenters and social demographics of the patients who present frequently, and that's how I'm hoping to link the CIFA data. And when I looked at it from the 2011 data, they were using deciles rather than quintiles. I'm just wondering.
Yeah. So quintiles, well, deciles means 10 groups, and so yeah, the less groups you have, the better, because it's just less data analysis. So if you can get it in quintiles, I would highly recommend that you look at it in quintiles. And you know, you don't need, I don't think you need to look at it in that much detail. Looking at 10 different groups, even 5 groups is a lot, because usually people, you know, they're interested in the highest and the lowest groups mainly.
Yeah.
And not so much, you know, the fine grain of 10 different groups. And within hopefully within the data, you would be able to combine the quintiles, the deciles, sorry, and make them into quintiles.
Okay, great, thank you.
Thank you, Viola. Thank you, Anita. Are there any more questions from the audience? Paul?
I was actually, I've been reading on this technique as well, like before. And I read somewhere there's a way to actually incorporate opportunity cost in the DCA. So although I wasn't like able to understand it very well, I wonder like what's the overview of that? Like how do we, is there a way to actually incorporate opportunity cost and the trade-offs like using DCA?
Yeah, I didn't look at that in my analysis, but I know that that was something that is in the paper that I showed the graph of, the Azaria paper. Yeah, I don't think I'd be good at explaining that actually, Paul. I'm sorry.
Okay, sure. Yeah. A little bit more about it.
Did you read about it in the Azaria paper?
Yeah, because I had a meeting before with Azaria and Richard, and then I was reading their work, but I didn't really had a clear idea. But I guess I should read those paper again. But yeah, Azaria is based in LSE, I think. But yeah.
Yeah, sorry, I can't help you with that one.
Thank you. Anita, I have a question to you. I wonder how long did you follow up the participants in this study, and if you are still like following up to have up-to-date data from later stages to see that the changes remain?
Sorry, what was the first part of your question?
Yeah, so for how long did you follow up these participants to calculate the decrease in consumption? And if you are still actually following them up so you can check the continuity of the decrease in consumption of this beverage?
So it was a model-based study. So the model followed people until they died.
Okay. Yeah. Sorry. Yeah.
And then or over until they reached 100 years of age.
But the original study where did you get the input data for the size effect? Do you know for how long people were followed?
No, well, this was based on price elasticities. So
okay.
It's just assumed that, you know, the tax would be in place for, you know, a long time, basically.
Mm-hmm.
You know, a bit like cigarette taxes. Once they're in, they stay in place. So the effect remains.
So the size effect of the price elasticity was based on an assumption?
No, that was based, the price elasticities were based on supermarket data.
Okay.
A separate study.
I remember.
That was an Australian study that they calculated those based on income groups.
Okay, yeah, that makes sense.
Yeah, and I was lucky to have that data actually, because to have that by income group, yeah, was just great for the study.
Yeah,
I probably wouldn't have been able to do it otherwise.
That data set must probably is still like a gold mine of data to do stuff like this.
Yeah, and I think, yeah, that's probably an important point, that, you know, you really need the effect size by the group that you want to look at, the groups that you want to look at. I mean, that's a really important starting point, I think. Because otherwise you just be modeling the impact at a population level. Yeah.
Paul?
Final question from me. Sorry, I have a lot of questions. So as someone who is interested in learning this technique, you mentioned that there are special interest groups that are working on this, but do you know of like any, I guess, courses or capacity building activities that we could participate in, especially if anyone would be interested to use this technique in our research? Or there's no turning yet for this one?
That's a good question. I mean, I know that Richard Cookson, he was running some courses, but they're in the UK. You could have a look at his group and see what they're doing. I did get an email the other day about health inequality course that's being run in Europe somewhere. And I did inquire about that one. I could quickly find that in my emails. Maybe someone else knows about it.
Yeah, the one in the Netherlands, wasn't it?
I think so, yeah. I was just trying to find out whether it was going to be run at a suitable time for Australia.
It's well, I checked it out. It's online, but it's during the day in the Netherlands, so it's a bit tricky for us to follow.
Yeah. What time of day would it be here?
I can't really remember. It was the Tinbergen Institute.
Yeah.
Yeah, I can have a look as well and send the link. I have it somewhere.
Yeah, great. Yeah, and also I'd recommend you get the textbook that Richard Cookson has written as well. I think I've got a copy of it here, maybe somewhere. Anyway, I think you'd be able to Google that, the Richard Cookson Distributional Cost Effectiveness Analysis textbook. Yeah, that would be my suggestions. Yeah, I don't know in Australia whether there's anything sort of happening like that. But as I said, you know, if you have any questions, I'm happy to help out if you have any questions in the future. Yeah, so that's
Here's the link. Yeah, so Marie has posted the link in the chat for everyone. Thank you so much, Marie. Anybody has any other questions? No? Then I think, well, first of all, thank you, Anita. This was a fantastic presentation. And I think we will close up here. We still have a little bit of the symposium left. We have a networking session for those of you that want to participate, and then we will also have the closing remarks from the chair of the symposium, from Paul. And we will get an opportunity to just get together later after the concluding remarks and just, yeah, share a little bit of time, even if it's still virtual. So thank you, everyone. And thank you, Anita, again, for participating in the symposium.
Thanks, Clara, and thanks, Paul, and thanks for organising the session, and thanks for the great interaction with everybody.
Yes, and yes, thank you very much, Anita, for that very insightful discussion, and Clara. So for everyone, we'll have the I copied the link to the closing event. I mean, please attend that because we'll be announcing other things as well in that, as well as the networking session. But I guess just to close this session, I think we uncovered a lot of things about examining equity and incorporating it in economic analysis. That there's actually a lot of gaps there are techniques in place that we could use, but there are also like challenges. And I guess this could be a very great areas of research, especially one like in this call. So again, so thank you very much and see you at the plenary session. Please use the link that I shared for the Zoom link and the password.
Thanks, everyone. Bye-bye.
Thank you. Bye.